Okay, so there's a few things to show here. We'll do this in a nice, quick, pithy way. So what we have is evidence from the scan is there's a lot of venous congestion all through the spinal column, and then actually any vein that can help is congested. There's the jugular vein on the left being entrapped at the choke point between the atlas and the styloid. Your styloids are really elongated and coming down and entrapping blood supply out in a horrible way. And when you bring your head down, it'll be even worse. There's the right side. Here's these long styloids. So here's the jugular vein. You can see how there's no contrast running through there. There's the atlas, and then it picks up and reconstitutes down through there. Now on the left, the styloid that has grown so far is actually making contact with the internal carotid, and I can show you in a different view how it's actually could be irritating it. And of course, it's closing off the left jugular as well. And this is with you. This scan is done with you lying flat on your back, with your head in a neutral position. So anytime you bring your head down, the styloid is going to be knocking the atlas out probably, and making your venous congestion even worse. Yep, there it is, making contact. Now, what came first? Well, I think hypermobility came first. So we typically have injuries, car accidents, and sprained. The neck gets sprained, and it's not bad enough for us to do anything about it. And these styloids will calcify. Other calcifications will occur in an event to stabilize us. And their body adapts, but then eventually this adaptation can become problematic. There's another shot of all the venous congestion. I did find, I don't even know what to say, that looks like a hole in your head in the back there. I did document that. I don't know what to do with that. But here's all this congestion, entrapment, congestion. The whole spinal column, or a large portion of the spinal column, seems to be helping you. The venous congestion is going down through the spinal column. Right, so there's where the skull stops. All this is venous congestion, and there was an ectopic arachnoid granulation decreasing venous flow. So you were born with a couple anomalies here that are playing out. Yeah, we found the first rib kind of low on the right side. On the left side, it's calcified over time, trying to stabilize. And we find these facilitating like a bobblehead, where the scalenes aren't really engaging and modulating correctly, so the person has a looseness there, and you'll see their head kind of bobble a little bit. Here we drew a line through the center of your foramen magnum, and then we added the atlas. You can see the atlas is rotated, anterior on the right, posterior on the left, and here this styloid is actually making contact there, and you can see how it's have a little space in there. If you remove your styloids, I would think we would remove this one first, just in case this one's making the rotation worse.
Okay, and that is the left, right?
That is correct. Here you can see where the styloid, the jugular vein is entrapped right there. There it is there. All right, and then of course, you look through the center of the spinal column here, and you see this vertebral artery. So you have a Dolichoectasia. There's the shot of the, so you have a tortuous vertebral artery. So you were born with a vascular anomaly in there that rides real close to your brainstem, right up there where the spinal cord turns into the brainstem area. And these can be dormant and not cause symptoms. And then when somebody has a hypermobile neck, they get a neck injury, and this Dolichoectasia can become symptomatic. And that's a tough one to catch. So it's actually functioning like a space-occupying lesion in there. We got this venous congestion acting like a space-occupying lesion. We have the atlas, which is, well, I haven't shown you how it's moving too much, but we got some hypermobility in there, and we don't have a lot of margin for error here. So basically, you have a common injury to your upper neck, and you're going to have an uncommon presentation because of your vascular and anatomical variants that you were born with. Yeah, that's a great shot of it. So structure affects function. I mean, that thing is in the middle, and it's supposed to run along the side, like this one. This runs along the side. And as we get older, we kind of get, our arteries and veins get a little more tortuous, and you don't have a lot of margin. So it's not a far reach to think that that's in play, and that could be giving you symptoms. And anybody you talk to about this, ask them, what symptoms do you expect me to have from this? Because whoever speaks first about that is not going to look, well, they're going to be vulnerable, whoever speaks first. Yeah, look at all this congestion. We waited a few seconds later and did a venous phase. My gosh, you got a lot of pressure in there, and that can't be fun. Yep, there's a good shot of it. Right, so here's the hypermobility. C1's coming off of C2 too much. And again, they say pathology stands on a three-legged stool. You got to have three things wrong with you before you really start to have bad problems. So you have this, you tear up your neck, you become hypermobile up there, and you're going to really confound your doctors. Anyway, C1's coming off of C2 too much. So what do we want? We want prolotherapy, or anybody who can tighten up any of these ligaments, the joint capsules. If you moved less, you'd be happier. Now these styloids are actually kind of wreaking havoc at this point too. You know, the idea, you take the styloids out, you become more hypermobile. How much of this motion is being compromised by the styloids? You know, you got to pray about that. Left head rotation, we look to see if the atlas slides too far to the right, and you look pretty tight up in there. This is where you are. It's rotation, C1, C2. That's your vulnerability. Yeah, you seemed okay sliding that way. Yeah, we'll look at these. Nice, pretty tight in there. Nothing ridiculous. Right there, that's C1, C2. Here's a shot of the Dolichoectasia. There's a good shot of it. You can see how the spinal cord or the brainstem actually is being displaced a little bit. Yeah. Oh, that's normal anatomy. Any questions? Anything you'd like me to talk about? You know, here's a better shot. Sometimes it's better to see it this way. Yeah, so look at that. So as a mechanic, I would like these styloids to be removed. I'd like you to move less. So is there a risk by removing the styloids that you become so loose that this has to be fused C1, C2? I guess it's a risk. I don't think it's likely, but you do need to know that. Yeah, I mean, yeah, and look at that. So structure affects function. Yeah, that Doli does not give you a lot of margin for error when it comes to an injury in your upper neck.
Okay, is the subclavian artery still being impinged over by your, what do you call that, like your collarbones or whatever?
I would rather you have a thoracic surgeon comment on that. That's above my pay grade.
Okay.
Okay, that's it.